This caregiver tip is called "The nurses are really the ones in charge." You know what? It's the doctor you may be dealing with, but it's the nurses that run the floors. It's the nurses that run the doctor's offices. And thinking otherwise would be a fallacy. We learned that one very quickly, that it's the nurses that can make the biggest difference in your life as a caregiver and that of your care recipient. And you know what? Like all human beings, like all of us, nurses tend to gravitate toward the patients and the caregivers that they like the most. And so what we try to do is win their affections. And it made a huge difference for us. It was amazingly invaluable than anything else that we could have possibly done. So to that I make 3 points. I offer you 3 recommendations. Number 1, you know what? The nurses are involved in dealing with people who are not feeling well. They hear their complaints. They hear about how bad things are. It's very rare that people actually ask to get to know them on a personal level. When they come in, say hi to them, or if you're going to see them, say hi, not just the normal hello, but get to know them, get to know their family, get to know everything you can, and treat them as if you would a family member. They'll gravitate towards you for that because not everybody does it. So that's part number 1. Second part is be different. Now, this may sound a little unusual, and if you're going to be staying in a hospital, understand the nurses go through a daily routine and not much changes. Do something different. Surprise them. First time we went to the hospital, I went downstairs to the cafeteria and I immediately bought 2 dozen donuts for them. And within a day or two, they kept coming by the room saying, "Thank you so much for the donuts." They didn't know who we were at the time. It was building a relationship. Once a week, we used to buy, whenever the shifts were changing, day shift was leaving, night shift was coming on, we would buy enough pizzas for every single nurse on the floor. And the reason for that is, again, we wanted to get them to know us. Bring them a snack, send them flowers, buy them a beverage, buy them a lunch. If you're going to order something, order for them as well. You just never know when that could be valuable. And quite honestly, it builds friendships. It worked for us. We became friends with our nurses, and they're friends with us today as a result. And what we found is the nurses are actually going to fight over you and your patient as to who gets to take care of you because it's fun. Now, there's one last thing that you really need to focus on, and point number 3 is a huge one, and that is find a way to make the nurses smile. Give them a reason to laugh. Laugh with them. How many times do you go into a doctor's office, or how many times do you hear in a hospital laughter coming from a room? We were laughing all the time. It made a huge difference. Doctors wanted to be with us. The orderlies, everybody wanted to spend time with us because we were a fun place to be. Nurses are no different. And what they'll do is they'll come in and they'll stay with you. And what's the value of that? They spend more time with your patient, your loved one, than they might ordinarily. What better reward is there than that? So my suggestion is make friends with your nurses, and hopefully these 3 recommendations will help. Hi, my name is Rob Harris. I am a caregiver to a 2-time cancer survivor. I'm an author, a caregiver advocate, a speaker, and a coach. I have a book coming out July of 2012 called "We're in This Together, A Caregiver Story." You can find it on my website at www.robcares.com. Have a great day.